Welcome to Therapy Thursdays here on Louisiana Living. I'm Dr. Jerry Yarborough, owner of Physical Therapy and Balance Center. Today we have a special guest, Dr. Rachel Atkins. She is one of our physical therapists here, and she's going to be teaching you about shoulder impairment.
I'm excited to share with you some helpful tips to improve your shoulder strength and function. First, I want to show you a little bit about the anatomy of the shoulder. It is technically a ball and socket joint, similar to the hip. However, it's not quite as stable. The hip has a very solid bony prominence around the head of the femur. However, the shoulder is not such. It does have a ball and it does have a socket, but it sets on the socket like this. And so most of the stability in the shoulder, in fact 60% of the stability, comes from muscular strength. And so we are going to do some exercises to strengthen the muscles that hold that joint together. When there's any weakness present, the joint separates like this and can cause a lot of excessive wear and pain, as well as eventually arthritis. So we want to keep that joint nice and tight. Before I show you those exercises, I want to show you one more thing about the shoulder, and that is the foundation of the shoulder. The foundation of the shoulder is the shoulder blade or the scapula. Here on the back of Frank, you'll have to excuse Frank, he's had a rough life, but he does have a scapula here, which is the foundation for the shoulder. Now, the scapula just sets on the back of the trunk and is held there by 17 muscles. So again, if there's any weakness in this area, the foundation of the shoulder, the scapula, is going to move into a position that is going to cause pain. So the exercises I'll show you will help to improve the stability of the scapula as well as the shoulder. And real quick, while I have it here, I want to show you an exercise called the hitchhiker. You hold the band in your hand like this, thumbs up of course, elbows by your side, and you just bring your hands apart like that. You're going to go ahead and do 2 sets of 10 on these, nice and slow. But an important thing that I want you to add at the end of your pull is to squeeze your shoulder blades together. So as you come out with your hands, you squeeze those shoulder blades together for just a second and then relax. Now, Dr. Jerry is going to be my anchor here for these exercises. The first exercise is called a row. Your forearms will be parallel to the ground, and you pull your fists straight back to your side and then come back forward. Squeeze your shoulder blades together as you come back and then relax. Do not shrug your shoulders at all. So back and forth, forearms parallel to the ground, and I recommend 2 sets of 10 to start out with. The second exercise is with your elbows straight, and you're just going to pull your fist down to your side as before, but the elbows are straight. Same thing, 2 sets of 10. And the last 2 exercises are called rotation, and you're going to hold the band in one fist with your elbow at your side, and you're going to rotate away from your body. 2 sets of 10 on that as well. And there's another rotation that's very important, and it's the opposite direction, rotating toward your body. You can do that, of course, on either side, but for the sake of facing the camera, I'm going to show it on the other arm. Now, we do sell these bands here. They're not expensive, and you can anchor it yourself at home by tying a knot in the middle and putting it over the hinge of a door, shutting the door, and then you'll have a stable anchor. So I hope you find those exercises helpful.
Awesome. Thank you, Dr. Rachel. That was great information.
Good.
And guys, remember, if you're having shoulder pain, try these exercises. It may give you immediate relief. So we just want to thank you guys again for joining us here on Therapy Thursdays. Come and see us. We'd love to help you love your life. Thank you.